Welcome back. Now, as the world battles COVID-19, new variants are making herd immunity a moving target. Now, there's been a global campaign to vaccinate as many people as possible. However, exactly how, of course, difficult would it be? That is the question to reach herd immunity. Now, let's discuss this with Dr. Silvia Bignamini from the San Francesco Clinic in Bergamo in Italy. Thank you so much, Doc, for your time, and good morning to you. It seems that herd immunity is now this promised land that we may never reach. It's more of a fantasy because previously, whenever in conversation with medical experts, different governments globally, herd immunity was a set target. It was attainable. It seems now it's a different story altogether.
Good morning. Yes, we need to see it from different perspectives. If you talk about, for example, Europe or my country, Italy, we have reached 57% of coverage for the people that can be vaccinated. So we can reach herd immunity quickly. Of course, if you talk globally and you look at other countries, even South Africa and other countries which are less than 10% of coverage, of course, we are far from reaching herd immunity. And since there is mobility, it's important to look at it at global level, because otherwise the efforts of each country cannot be enough to reach the immunity at global level, and the virus will continue to circulate and change.
Doc, are the new variants that we're seeing around the world the only challenge posing a threat to herd immunity globally?
What we are observing also in my hospital in Bergamo, as you remember, in Lombardy, we were very much concerned with the virus, and we suffered a lot last year in March 2020 with a lot of deaths. Just to give you an idea, in March 2020, we had also 1,000 deaths per day. In Italy. Nowadays, like yesterday, in the last 24 hours, there were 34 deaths in Italy because of COVID, related with COVID, with the virus. So there is evidence that vaccination, together with other measures, not alone, but also with the use of the masks, we are continuing using the masks, especially where we stay in closed places. But even open air, if there are many people, we continue using the masks and wash the hands, sanitize, and we track the cases. So if somebody travels, for example, even without symptoms, we do the test. Right. And then if it's positive, we recommend isolation for 14 days because of the variants as well. And what we are observing is people that are getting sick, ill because of the virus are much less. And the people in need of hospitalization, hospital care are really few in Italy nowadays. And the people that are dying because of COVID are really a little number, as I told you, 34 in the last 24 hours.
Doc, just from a South African perspective, I had a similar conversation with South African medical expert Professor Shabir Mahdi, and he was of the notion that perhaps we need to move from speaking more about herd immunity to speaking about how do we live with this virus. How do we ensure, as you mentioned, we abide by the restrictions and the rules in terms of staying safe, making sure we wear our masks, because that could be more realistic in a more South African perspective. Do you share those views when you look at a more global picture?
Yeah, I think we need to live with this situation, this pandemic, maybe for the next, I don't know, year or a couple of years or more. But what we saw, we can control it. We can control it with a number of measures. Even my colleagues, medical doctors, nurses in the hospital, they are not afraid as we were last year because we did not know what to do. Now we know what to do. We have to do and to put in place the measures that are known to be effective and constantly monitor the implementation of those measures. We have to keep attention to this. We cannot just relax and say, okay, we have herd immunity, that's fine, because we don't know about the variants of the virus. The virus, as all viruses, they change. So we don't know the new variant, what will be able to do. And we have to be really vigilant and to monitor the situation, but we know what to do. And if all the world, we do the same measures. Of course, each country has to adapt to its own reality, and people. But we need to communicate to the people and inform so that everybody has the knowledge that this is important, because really you can control the virus.
All right. Well, that's where we leave it. And thank you so much for speaking to us, Dr. Silvia Bignamini, Health Director at San Francesco Clinic out in Italy. All right.